experiencing inner silence. If we do not know how to be silent, it becomes very difficult to make our actions creative and meaningful. If we don't know how to experience inner silence, it's so easy to become the puppets of routine. And in time, this routine makes our life arid, dry, even empty, mechanical. It is silence that gives oxygen to the mind. And we take breaks during the day for many things, coffee, tea, speaking, but a very useful and beneficial break is to take a break for silence. A silence break means being able to step back and seeing things in a fresh way. I step back from the action and the responsibilities around me for a few moments. When I step back, I become still and I begin to observe. When I become an observer, then I'm able to see a clearer picture. I'm able to have perspective. Like the caterpillar only sees what is in front of its nose. Plodding along, it's eating, it's heavy. It doesn't see around itself, just what is in front of itself. But a bird, once it takes off from the ground, and as it flies higher and higher and higher, it's able to get a fuller picture. And a fuller picture is necessary if it needs to know where it has to find its food, where it has to find a new home, where it has to find water. And in the same way, if I'm able to step into silence, be still, become an observer, then I am able to get a true picture. That is, I'm able to find clarity. And when there is clarity, there will also be peace. When the mind is peaceful, when the mind is clear, then I'm able to step back into action and make the right decisions and not waste time running round in the same circles again and again, meeting the same problems again and again, facing the same difficulties again and again, and wondering where is the solution. Silence enables me to find the solutions that are appropriate to every moment of my life. This is not a difficult thing to do. Simply I need the attention to give this oxygen to my mind. Where there's oxygen, there's always life. Life is maintained. So as I value silence, I will use my time, my energy, and my consciousness in a more economical and more accurate way.
And perhaps this is more of a better starting place than the emotions that we go through with death and dying. It's actually the feeling of being out of control that actually leads to all the other emotions and feelings that we come across, whether it's anger, why this is happening now, why does this happen to me, what's going on, why should it happen now in my life, whether it's actually denial, disbelief, this can't be happening. Most people have a shock state when they're told about something that's very frightening, and the shock state is a feeling of it's unreal or it's surreal. It doesn't feel real. I know it's happening. It's not real. It doesn't feel like it's me. It feels like someone else is in the midst of this. I'm just watching a terrible story. And there's, people go through lots of fear, anxiety, depression, especially, and depression is especially a feature of that part of the process when we're losing control of our independence in life. So two of the greatest fears that people have is loss of independence and being in pain and distress. Loss of independence is really a harsh thing because it's a feature of becoming weak and when you develop a lot of weakness and fatigue associated with chronic illness and progressive chronic illnesses, when there might be weight loss, deterioration in health and well-being, changing physical appearances, becoming weaker, and the weakness leads to inability to do as much for myself and starting to have to depend on others to take more care of me. And this is a very difficult thing to adjust to as a human being because we're all built to be strong, in control, and independent. And losing control is the hardest thing perhaps we have to come to terms with. I'm talking about some of the mental and emotional aspects of this initially, and perhaps cover more spiritual things as we go along. Because definitely there's a phase of if you're diagnosed with something like a cancer, for instance, that I'm quite experienced with, not being diagnosed with cancer, but experienced with looking after people with cancer. But if you're diagnosed with it, if you have a diagnosis like that, it can be a complete identity crisis. Insofar that there's a shock, there's a new identity of being a cancer patient or whatever it is your condition is. You have to try to associate and accommodate. And then there's a loss of things you used to be able to do. Suddenly your life is overwhelmed by a change in a whole different world that you've been dropped into, that you're totally unfamiliar with, that you have no experience of. And it's like being probably dropped into a new world without a compass or a map. There's nothing for you to relate to, and you have to follow directions that people give you. So again, you have to trust people and give up your control of your own world. So there's this aspect of trying to accommodate and adjust. Identity crisis, the sense of self gets lost if you can't do the things you used to be able to do, even if that's going to work, hobbies, things that were an interest to you before, things that gave you a lot of sense of purpose and love for life, things that you start to not have the energy to be interested in. And I often have this conversation with people where they can't understand, they're demoralized, and then they relate that they are feeling very weak and I don't have any energy. And so I'm saying to them, well, if you don't have any energy, it's very hard to have concentration power. And if you don't have concentration power, it's very hard to follow things and maintain interest in things that you've been interested in before. So a state of disinterest takes place, and you can't fulfill the pleasures that you had before. And this is a phase of maybe progressive disease and weakness, where death and dying is studied much more in those situations where there's a process involved, like there's a disease or process of illness that people deteriorate from. It's that's known to be incurable. They may not accept it's incurable, so they might actually want to get on with and fight and try all the medical treatments that are possible, whether they're curative or not. Try complementary and alternative therapies, anything to avoid the idea of dying. And sometimes we look at this as very positive natured people, actually, and it could be a very positive nature that's doing that. It may not be denial; it could be maintaining hope, as much hope as I possibly can, by investing my effort and energy in staying well and avoiding death. So it's not always actually about living life to the full. Sometimes it's a state of death avoidance that's perhaps fear-based. And there is a bit of difference there because a positive nature and positive attitude can also be the nature and attitude that starts to accommodate the situation. It starts to face things. It starts to look at and accept that I'm not as well as I was before, and maybe I don't have very long to live. It starts to look at how I'd like to reinvent my life at the moment, and it starts to look at another positive nature, which is the nature of acceptance and letting go. So if I start to accept my circumstances and situation, it's not giving in, actually. Some people can think this is giving in, but it's not giving in. Accepting my circumstances and situation is a way of facing it in which I let go of the fear that's associated with it. And when you think about it, if you have acceptance of something, it has no power or control over your thoughts and feelings. So the states of acceptance disempowers the situation that might be a life-threatening health situation. But some people don't like that idea because it feels like it's a negative attitude and they're giving into it. And maybe it can sometimes be like that. So you've got to kind of find that sort of balance for ourselves. And what suits my personality doesn't suit the personality of somebody else. So it's tricky if you're a friend or a support person to somebody who's going through a change of life that involves dying of a disease or an illness, and especially where that's known to be in an active phase or starting to take place, because you don't always know what to say or what to do or how to respond to that person. They're still the same person as they were before, and you're still the same person that you were before, and you still have that same relationship, whether it's a friend or a mother, a father, a brother, a sister, whatever it is, they're still the same people with the same relationship. And if I have cancer, I'm the same person as I was before with cancer. If I have motor neuron disease, I'm the same person before I had the diagnosis of motor neuron disease. If I have another life-threatening illness, I'm still the same person I was before. And the relationship I have with you is still the same relationship. It's just that it's changed because something's come in between us. I'm sick and I'm dying. And that's come in between us. And now you don't know what to say or how to respond to me. And I feel that, and that hurts me actually, that people that were close to me, that I loved to be with, and that I enjoyed the company of, are avoiding me because they're afraid of their own feelings when they're around me. And so you need to subtly tune your own feelings out a little bit and remember the relationship, and then be true to the relationship. Don't worry about, take the death and dying situation out of it, and be true to the relationship that you have with that person. Don't suddenly become their best friend because they're dying, because that'll help them remember that they're dying rather than you're their best friend. So if you stay similar to how you were before in your relationship to that person, it's a great gift to them, because what you're giving them is normality, and what they're trying to find at the moment in the midst of their own mental and emotional distress is something to hang on to that feels normal. And if you're better than that, you sat quietly with yourself and become comfortable and more peaceful as a human being, kinder and more compassionate in a natural way, then your presence will actually have the feelings of that kindness and compassion and the calmness in it. And so they'll take that calmness and kindness and compassion from you when you're just interacting in a normal way without becoming their counselor or their best friend, or because of the, which once you start to act differently, counselor, best friend, instead of just being the brother or the sister or whatever it is, once you start acting in another role, it's reinforcing the fact that you're dying that I'm doing that. So I don't want to reinforce the fear and anxiety of that person by changing my approach, changing who I am to them. If you can stay who you are in the relationship, you'll be a great gift to that person. One thing to be aware of as well, especially for such a beautiful group of spiritually minded people, such as are tuned in here today, is that people's beliefs and faith and spirituality is failing them when they're in a state of anxiety and distress and despair and suffering. And they're not able to hold on to anything that seems to make a difference to that kind of experience they're stuck in. So be very careful about the way you use spiritual knowledge, either to judge people or to advise them, because you'll like 90% of the time get it wrong or feel like you just missed a little bit, it didn't work out. If you're more prepared to listen to where they're at and where they're coming from, you're more likely to tune into certain parts of their experience that you feel you can maybe be more helpful with just by emphasizing it or acknowledging it. Because if people are most people have their own answers somewhere deep inside them. And if they start to talk through their emotions and their feelings with you, and you don't interrupt them, and you don't give them solutions, you just give them space. This is the most valuable gift that you can offer them at that time, is you give them space to speak and to be who they are and to say what they want to say. It's so much better than the person who comes and gives you 3 books on the topic of cancer nutrition or whatever it is that we give one another, or offers solutions and everything. It's like as soon as you're offering solutions, if you haven't spent time listening to try to hear the person, to feel the person, to have a sense of where they're at and what they're looking for and what they want, what they're wanting, and how they're reacting and how they're responding and what they're doing themselves already to try to deal with their situation. And remember that people telling their stories is what you do when you're getting rid of trauma. So when you're traumatized with something you're going through, telling the story is the best thing you can do to free yourself of the burden of distress, anxiety, and fear that's there. So your listening is a very valuable thing. A lot of people don't want to talk. So if you listen and you hear they don't want to talk, don't make them talk, because you're likely to push them into emotions they're not prepared to deal with yet, and feelings. So just allow things to be. So the more you can let go and let be and allow people to accept and be where they are, the more power you're giving to them to be who they are, to say what they think is of value, and to enable them to work their own way out of the trouble they're in. So that takes a lot of self-acceptance and self-respect, and sometimes tolerance, because you're emotional too. You're a feeling human being, so hopefully you've got some emotion somewhere locked away in your heart. When you're connecting to...
Sorry to interrupt, but could you just slow down a bit, because the translators wants a little
more slow. Yeah, okay.
A bit slower so that they can translate it fully. Thank you. Sorry to...
I'll let you catch up with me. So I was saying that the more space you give people, and you give people space when you let them speak and share their experience. When people share their experience, it helps them with the trauma that they're going through. And some people need to share the experience over and over and over and over again. They may do that with you or with others or lots of different people, but they continually will do that to reduce the influence of trauma on what they're going through, the situation that they're in. And the more that you give them the space to do that, the more empowering that is for them. They feel that empowerment. And there's more empowerment there than if you try to offer them solutions, because often the solutions that you give people, if you start to give them lots of solutions of what they should do, how they should do it, when they should do it, as you give them all the solutions in the world, what you're doing is you're hiding behind the solutions you're giving, so you don't have to experience the distress that they're going through. So you become the solver rather than the empathic listener, the compassionate carer. And there's a big difference between those things. One will give power to the patient, or not the patient, the person who's sick. The other will disempower them. I mean, if they need solutions, they must be dependent, mustn't they? So don't give too many solutions. Listen first. Be sensitive. Have that empathy. Sometimes it only takes a minute of listening to get a sense of where someone's at. They don't want to talk about it. It's quite clear. Don't make them talk about it. You know, you can share. Do acknowledge things between you. You know, someone's received a diagnosis and you've heard about that. Don't just pretend things are normal and tell them how good they're looking. You know, you're looking very well. A lot of people who are sick get fed up of people telling them they look very well, because it sounds like it's hiding behind you look very well, rather than, you know, you know what I mean. You look very well today. You're looking great, and the person knows they might be looking okay, but no one would tell me I'm looking great every day of my life, unless I was dying. So it's kind of not natural, and if it's not natural, then people will pick up that it's all about what's wrong with them, that you know what's wrong with them, you're not acknowledging it. So acknowledge it, you know, say, listen, I'm sorry to hear, I heard recently from so-and-so that you've had a health problem. And, you know, I understand it might have been something significant like cancer. There could be, you know, there could be anything, but you know, just wanted to know, I'm sorry to hear about that. And then just be normal. You don't have to talk about the cancer, you don't have to talk about anything unless they want to. If they want to, it's because they're trying to remove the trauma of the diagnosis from their minds, thoughts, and feelings. And if they want to, then the best thing you can do is to let them, and don't try to fix them, because letting them is fixing them. When you try to fix them, you make more complications come out. How much time are we doing?
Have another good 20 minutes to go. Yeah.
So have I spoken for that long? No.
No, you can continue sharing. Yes.
Okay. Yeah, that's fine. So there's no, as I was saying before at the beginning, there's no fixed or set way of making death and dying fit into boxes where people go through this, and this, and you can't list 5 different things to go through with 5 solutions to it. It's human beings much more complicated than that, and we need to maybe acknowledge that everyone is unique and individual. Our relationships are unique and individual, and we need to stay true to that, but be true to yourself at the same time. Like, one of the things that you have a gift of, that many people in the world don't have a gift of, is you've been studying meditation and possibly spirituality, which means it gives you a sense of being able to connect to a deeper part of yourself that is the spiritual part of yourself, and it's the only real way forwards. And now, if I want to connect with myself on a regular basis, I do so by meditation these days. Although the meditation practice that I have is very simple kind of form of remembering that I'm a soul, that I'm a spiritual being, that I'm eternal. But when you start to do that on a daily basis and you start to brainwash yourself with a kind of knowledge around that spirituality, and you do that on a daily basis, you start to center yourself in a way that maintains calm, maintains peace, is accommodating, adjusts easily to the people around you, is tolerant of the differences between us and of the nature and personalities that are difficult to manage. And so it enables you to hold on to who you are, the real self, the true self. And every single self that's true or real is peaceful, loving, pure, and generous. So, and kind. So every single human being has within them core qualities that are to do with the actual nature of the spirit or soul itself. And the more time I spend with that, the better I will be at adjusting to the feelings and emotions of others, and to death and dying, whether it's happening to me or to someone else. I've got no doubt now that 30 years of meditation, practice, contemplation, reflection on spirituality has given me a much more centered space to work from, in which I don't lose my ability to care or be compassionate. I mean, I'm 60, what am I now, 60 something, 66, and I've been practicing palliative care for about as long as I have Raj Yoga, nearly 30 years. And there's no doubt in my mind that when I go around and see patients under my care, so I work in several settings, work in private hospital settings around a small Sydney area called Wollongong, and I go and see people in their own homes. So if people are not well enough to come to, and outpatient appointments, so in a clinic, in a private clinic as an outpatient, hospital settings and people's own homes. And it's really become more and more of my awareness that I do less and I try to understand less than I used to when I'm with people. I used to try to understand more and try to do more, but now I'm with people and I give them plenty of time and space to talk to me, to ask their questions, to express themselves, to let me know. And they'll tell me what the content of their suffering is. They'll tell me whether they're in pain, got nausea, constipation, or they're existentially distressed with fear, anxiety, depressed or angry about something. So if I give them time, they'll talk to me about all of those things, and they'll tell me their clinical history without me having to ask them lots of questions. I sometimes think we ask so many questions as doctors when we see a patient, that the patient gets more and more kind of confused, and then they can't tell us their history at all. I don't ask too many questions; they tell me the whole story in no time. So I think I save time by not asking too many questions. But what I've noticed more and more is that I think because I'm older, people accept what I say more than I used to. But also the practice of spirituality over a long period of time makes a difference to the quality of your presence at the bedside. And the quality of your presence at the bedside is borne out by the quality of attention you give to people and the attitude that you have developed. So I'm not actually trying to be spiritual at the bedside or to give peace or donate love or joy or happiness or trying to heal the patient. I'm actually just comfortable with myself, comfortable with the role I'm playing with people, and generally comfortable with death and dying, my own death included. So I feel generally comfortable with those things, and it's that general comfort that means I've become natural amongst people who are in distress around the circumstances of a dying process. And if I'm natural and I'm just being myself, then it puts everyone at ease, because they just feel that, and there's a kind of calmness that's transmitted, and people give me this feed this back that they felt so much better afterwards. And it wasn't because of what I said; it was because of being who I am, and not interfering with them too much. I remember, this is now a bit for the Brahma Kumaris here. I remember I used to love Daddy Gulzar very much, who was one of the senior teachers of the Brahma Kumaris. I loved all the daddies, of course, but what I loved about Daddy Gulzar was when you were in her presence, there was no feeling like you had to be anyone else or be anywhere else. There was no feeling like you had to impress her or do anything. You could just be who you were, and it's like a total permission to be who you were. And this was her degree of self-acceptance that allowed her to accept whoever was in front of her completely and unconditionally, without judgment. And people talk about unconditional love all the time. They have no idea what it means. Unconditional love isn't even the love of a mother for a child, because a mother does have some expectations of the child actually liking her back or something like that, you know. Or even like the unconditional love of my child is unconditional because it's my child. It's not really unconditional love. It has some condition to it. So unconditional love is a pure spiritual state of being that gives people the freedom to be who they are, and it gives you the freedom to not need to interfere with their space. And the less you interfere with the space of others, the more they have a sense of empowerment and strength and courage to face what's going on for themselves. So it becomes like your spirituality starts to give them the freedom and courage to face what's happening in their lives. You don't have to say a lot about it. You can say a little about it, such as summarizing the recent results that we've had through, or whatever it is, not taking people's hope away completely, but understanding that if things don't work out during the next treatment, there might not be very much longer left, but we're still hoping that things may work out with the next treatment at the same time as that. So you find little comments or things to say that doesn't remove all the hope, or say, what are you going to, make you face death. I've known people to actually force people to face their death, and it's just like, you think, oh, come on, no, it doesn't work like that. I mean, perhaps it does work like that in relationship to that person's nature and personality, and their relationship to the person who's dying. Maybe it does work out, but it's not my way. So my thought is, if you're going to make people face it, then you've got to be very subtle and kind and careful with your words, because your words can be a great comfort to that person, and they can be a great sorrow. People who are leaving when we're feeling like we're going to lose someone that we love, we want to hold on to them. And I can remember a man who just wouldn't let his wife go at all. He just held on to her. He was desperate that she had all the treatments that the oncologist could possibly give her. Even when she'd come to the end of what she wanted, she got to the point where she just wanted to die, and she'd had enough. She was sick of it all. And I took him aside, and he said to me, I cannot bear the thought of a world that my wife doesn't live in. And it made me realize that we do so much for ourselves, don't we? Like, he wanted her to live for himself because he couldn't bear the loss of the relationship. I don't want to call that selfish. I guess it's an aspect of attachment and distress that he's going through at that time. So it could happen to any of us, and none of us really know how we'll react until we're in that situation. So we have to be very careful with our judgments that we don't judge people for the way they react and do things. It's important that we go from a really self-accepting, deep spiritual philosophy that I'm a soul, I'm eternal. Once I'm a soul and I'm eternal, I'm looking at a different world from I'm a body with an ego that's going to die. I'm a body with an ego that's going to die is a very different consciousness than I'm a soul, I'm an eternal, and I have a temporary relationship with this body for this lifetime. It's a huge difference between those two things. And so there's two worlds. One world is the perceptual world of the ego, and the ego will just create a world that it wants to hang on to. So it won't want to die. It wants to just live forever, but it can only live forever through the body, and that just ain't going to happen. So the ego has to let go eventually, and soul consciousness arises, where spiritual consciousness is much freer, because the I that is spiritual is not attached to the body or relationships or anything of this world to give itself identity. Whereas the ego, the I of the ego, is attached to the body, to relationships, to possessions, to success or failures of this world, and that makes it who it is. And it can't let go. So ego can't let go. Eventually, it's the soul that actually, it's going back into the consciousness of soul. The sort of, as I move towards that, people will do this even when they don't have spiritual beliefs, okay? I've seen some people die more peacefully with no faith whatsoever. Their whole religion was built around family and the people they cared about and were closest to, and their special relationships. And they'd lived a good life. They'd enjoyed their life. Their memories were positive memories. So looking back, I had a good life. So I'm at peace with this. Is my time to die now. And the relationships that were good. So they're making peace with their relationships. Someone was a black sheep of the family, went away. They tried to make somehow. Sometimes that will come to a fruition where that relationship gets settled as well. And the person who's waiting to die can pass quite peacefully from this world without a lot of spiritual kind of paraphernalia to go with it. But spiritual people can die peacefully too. and hopefully your dying process reflects your living process. So people who have been abusive and angry in their life often persist with their abuse and anger towards the end of their life, except they start abusing people like me, the doctor or the nurse or someone, as they get towards the end of their lives. But people tend to die a little bit as they've lived. So if you started to practice gratitude for your life, and you look back on your life, and you're even grateful for the things that went wrong, which is like acceptance of the things that went wrong and the situations, the people that have hurt you. If you start to accept those things and be grateful for the personality they've helped increase your kind of tolerance, patience levels, and your power to be more courageous. As you thank those people from your heart and you practice gratitude, you're starting to practice dying peacefully. As you go along in life and you start to contemplate the soul as a reflection of God's pure nature, and you start to go deeper and deeper into that pure nature of the self as the soul, and you start to feel the expansion of the self in meditation and peace, then you've started to practice dying peacefully while you're living, because you're actually practicing living peacefully. Because what's happened to me naturally, and I mentioned before, like the presence at the bedside, when you go to the patient's bedside, and you just do the things you naturally do as a doctor or whatever it is, as a friend or a family member or whatever. As you do things naturally, there's a power to your spiritual practices that contains both the routines, the depth, and how long you've been practicing these things, that they become personality traits. So you've changed your personality traits. So a natural personality trait is I become more tolerant of people wasting my time, because it's not my time anyway. But I become more tolerant of people having their own attitudes and opinions about things. And I don't get influenced by the attitudes and opinions of others. It doesn't make me feel differently about myself or react to them. So when those things are not taking place, I'm actually able to hold on to the natural compassion and kindness that is my true nature. And so I don't lose that when people are being nasty to one another or to myself. I hold on to that because I've learned to sit beyond that in that kind of quiet space that we create in meditation that's part of spirituality. So your spiritual support and care of the dying is you. It's who you are. It's bringing you into their world, being true to the relationship that you have with a friend, brother, parent, child, whatever it is. You're true to the relationship. You don't believe they should talk about it, but you give them the chance to, the opportunity to. And if they do, it's great because they can unburden the trauma. And always remember that people do not grieve normal grieving where they recover from the loss until they've dealt with the trauma that was associated with it. So if the imagery around the loss of that person or the intensity of the attachment was such that it was so traumatized because I just lost a part of myself, or I'm so traumatized because of the lack of compassion shown by the doctors, or I'm so traumatized because of what actually happened to the dying person at the time of their death. If I haven't managed the trauma, then I can't grieve. I can't get through a healthy grieving process. And so you might need to start off with, if you're finding that you're still in that really terrible, dark place where even years later, there's no time frame for grief either, but even years later, you're getting waves of this dark place, this fist of kind of that gets around the heart and just grips it with darkness. That's unspeakably distressing, and you can't barely find words for it. If that's happening, it may be that you need to see a trauma specialist to work through the trauma that was associated with the loss. Because if the intensity persists for too long, it's to do with something other than the separation that took place. Is that a good Om Shanti place? Om Shanti.
Yes. Oh, thank you so much, Brother Roger, Dr. Roger, for sharing that deep insights, especially when you're talking about how the patient themselves losing control, right? And then the caregiver's role in their life. So I'm going to pick up on that. Like, have you ever experienced whereby, you were talking about trauma and then them accepting it? Because this is part of my personal experience with a student of mine who passed on with sarcoma, the bone cancer. But however, like if the patient accepts it, but then the pain is around them where the family are not able to accept it, and the pressure, so one, the patient is ready to die peacefully, but then the family doesn't want to live peacefully around them. So what would be your response to it?
It's actually one of the important things is that when the family's in chaos, and the family's in chaos mentally, emotionally, and because they don't have the same way of looking at the person's situation, and I feel that one of the things that I do regularly that's important is have a family conference. The family needs to be on the same wavelength about the disease. If they're not, then they've all got their own ideas, throwing in their own treatments and their own solutions, and everybody's just getting more and more sort of afraid and anxious, and they start to argue with each other, and the family can fall apart over all of that. So I find something that we do in palliative care regularly is we'll have a family conference. So we don't just look at the patient as being our patient. We look at the client as the whole family unit, because the whole family unit is part of the well-being of the patient as well. So if we can get the family in the right place and working together, it makes a big difference to the calmness and peace of the person who's leaving this life. And that consultation will be sitting down and going on and giving them exactly the extent of the disease and the illness, explaining why they've got symptoms in relationship to where the disease is known to be, and why the person has got the fatigue and loss of appetite, loss of energy, why the person doesn't want to eat anymore, and those types of things, and sort of addressing those to say things like, listen, when people have chronic illnesses, they develop disinterest in food. Like, it's not even loss of appetite, it's like just no interest in eating whatsoever. There's flavor changes, food doesn't taste nice, and it's actually torture to make myself eat when I don't want to eat at that stage. So explaining things like that to a family where everyone's just wanting to feed the person, and nutrition and food is the most important thing because they're not eating. Trying to get that kind of education in can make a big difference, because everyone will say, oh, it's okay, so it's just because of the disease. Yes, that's all, it's where it's at. It's not important anymore. It's not worth the stress of stressing over something like that, and when there's so much more going on for you to think about together. And to try to reorientate everybody, but to put people on the same page makes a big difference in those situations. You can't do it as a friend, though. It needs to be done through medical intervention, either a good nurse, a good knowledgeable nurse, or the doctor involved who can explain what's going on to people. And if you take the whole family together, then instead the family might have their own ideas and their own way of taking that knowledge that you've just given them, but they'll stop fighting one another about you should do this and you should do that, because if you give good education to people, they'll accept your they'll accept that you've got the experience and understanding and the knowledge, and they'll take that and start to be guided by you. And so they all get guided together then, and you can make a big difference. And then family will stop pressing the person to try to keep living, keep eating, keep doing whatever they have to do, and start to recognize that if I take them out and run them all around Kuala Lumpur or something for a big treat, I'm actually going to totally wear them out. They haven't got the energy to do it. They can't. So it's the last thing on earth they want, because they're feeling unsafe and insecure when they go out, and they might like to just stay in the small environment of their home where they know where everything is and they feel more in control of things. So yeah, it's the family needs to be information seeking. It's hard to get information from doctors sometimes, and hospitals and places where you're getting treatment. So if you can find a good palliative care doctor, they'll talk to you for sure.
Right, that's thank you for that response. And there is very interesting question here that might involve both your experience as a palliative doctor as well as your spiritual journey, whereby someone is asking a question on what is the process of dying and how does it feel, and will we meet God?
What was the last part?
How will we meet God after that, or will we meet, and how will we meet? So it's both the spiritual aspect and also the physical aspect of dying, or the process, or what happens. And
so I can only give you what I think. Maybe
just
not.
a perspective, perhaps.
Yeah, I can give you a bit of what I think.
From the floor, yeah.
I think that the moments of dying is for most people like going to sleep, really. There can be, a lot of people can get agitation and delirium towards the end of life. Probably not. That's probably not a pleasant experience, but we do respond to that usually by using some sedation. But it is quite normal. So there's a period that could be quite a challenge where we're leaving our body and we don't really want to go, and there's possibly a bit of a push and pull at that time. But I think even if there's a struggle going towards the end, the difference between the struggle and the release when you separate from the body and let the body go is just amazing. And I believe that is a kind of feeling of complete and total liberation and freedom, a feeling of moving into complete and total peace, and really like a joyful sense of separation. Maybe there's things that we have to pass through after that. I mean, it's not something that I've studied. The Buddhists have done more studies into the dying process than the other religions, and they suggest there's different flavors or bardos of life, kind of reflection of looking at things that are into our lives and where we've been and what we've done. There are people who have done studies on reincarnation that have looked into between lives, and a consistent thing that seems to appear in the between life memories of people taken back by hypnosis are hospitals and libraries, so places to heal and places to learn. So perhaps we take a lifetime and then we have places where we heal and learn from our life reflection before we take rebirth. And meeting God, I'm not sure whether we meet God or not after we leave the body. Certainly we can learn how to meet God before we leave the body, and that's called Raja Yoga. If you learn to sit in the remembrance of God, you find yourself expanded peacefully and eternally beyond everything, even beyond a sense of self. You even lose that sense of self into that feeling. So I think we would have a feeling of losing our sense of self, and that might be a little bit frightening too. That feeling, there can be a brief feeling maybe that's frightening, the desire to hold on to the old body, but I'm on my way now, so it's too late. So there might be a bit of mixture, but I think overall it's a feeling like going to sleep and waking up in total peace. But then where do I go from there? Then that's the journey. So, and you can only be here in the now. So remember to just stick with where you are right now.
Thank you so much for that. I really hope whoever asked that question, hope Dr. Roger has responded to that question. And moving on, Brother Roger, have you ever encountered some of the most enlightening experience of your patients before they depart? Like, did they share anything, if it is possible for you to share here, if it is not private, like what are their feeling when they, if they have attained that dying is peaceful, what is their expressions usually? And
I'll give you an example of a patient that I looked after. And there's a lesson. So there's the example and there's a lesson. And I'll reinforce what the lesson is afterwards, because the example is maybe not as powerful as the lesson. There's a patient I looked after. He was in his mid to late 50s age-wise. So he was about 55 years old. He was an alcoholic with a major drinking problem who had destroyed his liver in his lifetime, and he'd destroyed his family and friends and connections. So he was a totally alone person, very isolated. And he only came into hospital on the day that he could no longer walk. He wasted away at home, very sick with liver cancer and liver failure. The liver cancer and liver failure being part of his alcohol usage over his life, without judgment, but it's part of that. And he was a really didn't want any contact with people. He wouldn't let the nursing staff come near him. He wouldn't have anyone present. He was just an angry person who just made everyone go away. And nobody knew what to do with him because they couldn't do anything for him at all. He was just a withered shell of a human being who was just curled up in bed, wasted. He was almost like he had no fat on him. It was just all bones. And he was obviously not going to. He was obviously very close to dying, and he couldn't go home because he couldn't walk or look after himself. So he was stuck in hospital, and he didn't want anyone to come near him. So I was asked to go near him. So they asked me. So I was asked by the liver specialist to see him as a palliative care consultant. And I walked into the room where he was. He was in a 4-bedded room, and his curtains were closed around his bed. And when I opened the curtains, he was just curled up in his bed, and he just looked really angry towards me and didn't want me anywhere near him. So I now was thinking what to do and what to say. So, like before we said, you don't always know what to say. Well, I didn't know what to say here. There was no script for this situation. He hated me instantly. So I said to him, I gave him my name, and I said hello, and I'm Dr. Cole from palliative care. And I explained to him that he was too sick, that he wasn't going to be able to go back home, and that he didn't have very long to live, and they were going to move him to the hospice or the palliative care unit, which was in another hospital. And so I awkwardly said those things to him. I didn't listen to anything because he wasn't saying anything. He was saying everything without saying anything. He was just saying, "Go away, get lost." Maybe even not quite, even worse language perhaps that could have been associated. And then I turned to leave, and I got to the curtains to open the curtains to go out, and it came into my mind, what a terrible way to die. What a terrible place to die from. And so I stopped and paused, and I turned around, and I did everything I say don't do. I invaded his space. I walked across to him in bed, and I put a hand on his heart like that. And I said to him, "I'm so terribly sorry that you're so sick. There's nothing we can do to make you better than this, but we'll look after you. When you come over to the hospice, we'll look after you like a brother and a friend, and take really good care of you, and make sure that you don't suffer too much through all of this." And he put both of his hands over mine, and then I put my hand over his. And his tears came into his eyes, and he just softened. That was all. That finished there. And then it took about 3 days to get him across to the hospice. So I was able to visit him about 2 days later, and his attitude had changed completely. He's kind of smiled. He was letting the nursing staff look after him, and he smiled. And he looked at me, and then he was quite grateful looking at me. And I could see that he changed considerably and completely. I said to him, "Listen, you look so different from 2 days ago. What's happened?" And he said to me, and I could hardly hear him because his voice was so weak, and he was breathing and so whispering just about. I had to lean forward so I could hear him. And I was hearing. He said to me, "When you were talking to me, you talked to me about palliative care." And afterwards, I was thinking about palliative care over and over and over again. I was thinking about my life over again, and everything was so, all the abuse that he'd done for his children. He'd abused his wife, everybody he'd abused. No one was there for him. And he said, I went over and over this after you talked about palliative care. And he said, and then I just realized something. just had this moment of realization. And I said, yes. And he said, nothing matters. Nothing matters. Nothing matters. Whatever happened, nothing matters. And in nothing matters, everything went away, and I just felt so light and so happy and so contented that I'm not afraid of dying. So the thing that happened there was I became a human being, and the lesson is that nothing matters, because so much that we build up our opinions about and beliefs about and things that we think really matter is a world of illusions created by the ego that doesn't exist. The only thing that exists is the spiritual side of it. And when we let go of what doesn't exist, we get everything that does exist, and that is peace, contentment, bliss. This man was in bliss and happiness. And for all his sins of his life, nothing mattered at this point, at this moment. He was like with God. It was kind of, and you have to be very careful when you judge people, because you're using life as if it matters against them and against people. Stop using life as if it matters against people and start to think about, what am I really for? I'm for peace, joy, happiness, bliss, relationship with myself, and knowing who I really am. And that's what he had at the end. That was his enlightenment. And it perhaps, I don't know, I played a big part. I went back at that bedside. I invaded his space, so he could have actually got more angry with me, so it could have gone terribly wrong. I just did something that obviously was quite healing. And it was healing because it included him back. I included him back in the human race. You were treated like a brother and a friend. His hand on his heart. Major don't do that with people, but having said that, sometimes magic happens because you do something you shouldn't do.
That is absolutely beautiful. And I remember reading that from the book, Mission of Love, but it's just absolutely beautiful, Brother Roger. I mean, I feel the key is your deep compassion and empathy towards that soul, that being, and that brought I brought that enlightenment to him, and hopefully I believe that he passed on peacefully. And so the next one, there's someone asking that should we allow ourselves to feel sad or the emotions of pain, regrets due to illness or lost? That means individually as illness or the illness of other, or the loss of someone, so that we could move on in life. How long could we do that? Like the fear aspect of it.
So don't avoid it. Don't avoid feelings and emotions. You're a human being, be human. But do understand that there's a place deep within you that is already healed and that is free from the sort of negative thoughts, feelings, and emotions. And it's a very pure and positive place. But if you try to deny feelings and emotions that are there and suppress them, they'll continue to influence you forever. As long as you're trying to suppress feelings and emotions, it's based in fear, and you will actually not be able to get rid of them. You might be able to distract yourself for a little while, but they'll still be the core center of your being. If you have a serious emotion, a present emotion you can't get away from, then just allow it to be, just accept it as part of you. When you allow it to be and you accept it as part of you, so focus on that emotion in meditation, allow it to be and accept it as part of you. Because you've accepted it as part of you, it doesn't have the power to influence you as much. So you start to disempower those emotions and feelings by accepting them rather than trying to get away from them. So don't try to get away from negativity, accept its presence, and then you'll find the more positive part of you will start to take over in a natural way, because the more positive part of you is natural, whereas the negativity is unnatural. and the things that are unnatural are not real, and eventually they don't exist. So don't try to be forceful with your emotions. Allow them, accept them, and that way you'll let them go. And by letting them go, you'll be letting go of the power and influence they have over your thoughts and feelings. And your thoughts and feelings are generally positive, really.
So there is no a set time for anyone to heal, right? In that sense, Brother Roger, like, because they're asking how long could we do it, but is there a set time for it?
No, there's nothing set or fixed. There's probably some, there is a question of whether you should get some help or not, and not just keep on trying to help yourself all the time. In other words, is it worth seeing a counselor or a psychologist or someone to help you through emotions? Definitely, if you've got excessive feelings of anxiety and they're associated with kind of panic sensations, and you're reacting in a way that seems to be more than the situation should be, or people around you think it's more than the situation should be, then you're likely to have in the background to that a significant traumatic event in your life, including abuse as a child. Because what happens when we go through trauma and abuse is we have, for a period of time, all control is taken away from me. And when I'm out of control, being abused, that period of time might go on for certain, I don't know how long, maybe for years sometimes. Now I get a diagnosis, I'm not in control of what's going to happen to me. I'm out of control. Immediately, the out of control feeling takes me back into the abusive situation, and that becomes overwhelming. And no one can understand why I can't understand why I'm getting panic attacks. It's not that big a deal. I usually deal with things better than this. Why am I getting panic attacks now? It's because it's got some kind of a tie into a really bad past experience, and you might need help with that, because that's the trauma that needs to be sort of dealt with before you can properly, naturally accommodate, adjust, and move on with the diagnosis and the treatment. I mean, people are very anxious just before treatment starts, and I sometimes get sent, my colleagues send me patients to try to help them through their anxiety and distress. And in the last week, the oncologist has seen them a week before, and during the last week he started the treatment. And what was causing anxiety with the patient was getting started with treatment. Once the treatment was started, they felt more in control, and that was okay. So they go back to see the oncologist. The oncologist thinks that I've cured them, I fixed them, but actually it was getting on with the treatment that fixed them, and now they're more confident. So there is a process related to to diagnosis and onset of treatment as well. And the anxiety is less when you get started with treatment. You can focus on positive things, the future, hope about responding, and things like that. So, sorry, what was the question?
Yeah, that if they should allow themselves to feel sad and,
Yeah.
Emotions of pain and all that, which you responded, Brother Roger, beautifully. And so I hope Brother Roger has responded to all the questions from the floor. And I have one also, that, sometimes when it comes to illness or a terminal illness in any form, the caregivers take so much upon them. Yeah, a lot of stress and pressure. What would be your advice to them?
I missed the middle part of the question.
Sorry?
I didn't quite hear the middle part of the question. Just to ask it again.
Yeah, the caregivers of those who are taking care of the patient who are ill, it takes a lot of pressure on them as well for the caregivers. What would, their life itself will be so chaotic. So what would be your advice or tips for them to really live peacefully while taking care of the ones who are terminally ill? Because they take a lot on them.
Actually, they care too much sometimes. I mean, there's a question of caring too much, and for some of us, caring too much has become part of our identity, and is part of our nature and part of our personality. But I need to be a caring person, and perhaps what I need to do is start to learn. I think I've learned more and more that I have to become more centered in my spirituality first, and then more caring second. It's really important not to get too carried away with the emotional side of spirituality, like loving everybody. You know, let's face it, if you loved everybody, you'd be like half dead by the time you're 7 years old. Mind you, it's easy for a 7-year-old to love everybody, maybe, but loving everybody is not as powerful as being stable in love, and to have other qualities such as tolerance and patience that actually stop you being affected and influenced by people's situations, and not to be so compassionate that you forget that it's not your karma to fix everything. It's not your karma to go through the processes they're going through. It's something that actually belongs to them. You're there to do what you're there for, and so you should do that with a really good heart, and then let them. Then after that, the rest belongs to them, and you need to define what belongs to you and what belongs to them in the caring relationship. Sometimes you're trying to fix what belongs to them, when really you just need to do what you're there for, to take care of them with good heart and with kindness in your nature.
All right. Thank you so much, Brother Roger, for sharing with us and for your time. We could go on with this conversation because it is beautiful. It's very deep as well. But because of the time that we have today, I believe that we have covered, and we had such a lovely conversation about living and dying peacefully, and all your insights matters. I would say that what I picked up is, when we are living peacefully, we'll have a beautiful dying peacefully process. And also for those who are caregiving, to really understand our role and to really keep ourselves stable, first of all, spiritually, that will really help to deal with the entire process. So that's what I took away. And also, again, the aspect of fear and letting go of that for the sake of the peace of both parties in the relationship who are facing living and dying process. So that's really wonderful, and we thank you for that. And we thank everyone who stayed back with us today for the program. And I believe that it was much benefit to all of us. And for those who are staying with us, definitely please keep up with our Facebook page and YouTube channel for further program and the updates. So before we end the program, I would like to thank Dr. Roger for being with us. We are very, very grateful. Beautiful insights and deep experiences that you shared with us today, and from the organizer and from the Meditation Cafe and from myself personally. So we thank you so much, and perhaps we could all stay back for a bit, whereby Dr. Roger can take us through a beautiful meditation commentary to finish the program. Thank you very much.
Amina, I didn't check with you before. Do you put some background music on? Can you do that?
Maybe the technical people can arrange. I hope so. I will just get back to them.
It doesn't matter if we can't, but I haven't got any background music here.
Oh, no music. They can't play the background music.
Okay, no worries. No
All
problem.
right. All right. So everyone just sit back, relax, and we will, Dr. Roger will take us through a beautiful meditation experience. Thank you once again, everybody.
Okay, so just sit comfortably and relax, and we'll try to pick up a few of the sentiments that we shared during the last hour and a half. And you can do this with your eyes open or closed, whatever your preference. So just take a couple of deep breaths, relaxing deeply and completely. Allow yourself to become present in this moment now. Nothing that happened before this moment needs to be in your mind, and you can free yourself from thoughts and feelings about where you have to be and where you have to go and what you have to do. Just allow yourself to become free and comfortable with yourself sitting here in the now. And let this thought of pure peace become a feeling of energy just behind the eyes, in the center of the forehead, like a pure, tiny point of living peace. This is my original nature and my original form before anything in this world came into being. Nothing has ever changed this nature or form. It became conditioned by life, conditioned by pure positive experiences and by negative experiences. I have acquired a whole framework of reference by which I perceive the world around me. And the meaning that I give things has been influenced by situations and people that have happened before. The meaning that I give things is most likely to be false. And I create around myself a false world in which attitudes are false, people are false, and my beliefs are false. I let go for a moment of everything that creates these illusions. And as I let go of these things that create illusions, I find that I am unraveling the things that happened that created them, the situations and people that I need to forgive. And I just let go of everything that sits in front and hides my true nature of peace, my true self, the soul that is eternal. And as I sit in the soul that is eternal, I see this other self like a fog or a mist or a cloud. And I notice the more I sit with peace, the more I become the light that I am, the more that I am loving and kind, the more that I retain the powers to tolerate and to adjust and accommodate situations. I'm becoming natural and real, and the unreal world disappears, taking away illusion. And in the truth of my pure natural being, the truth of my soul, I let go of the world that I was seeing, and I feel free to expand into this peaceful, pure quality that contains truth, love, and happiness. And I realize, as I sit quietly, comfortably with myself, that I have died. The world of illusion has gone. The unreal world has disappeared. The truth of who I am is not opposed by anything. And I don't attach myself to anything of that unreal world. I am connected by love to all and everything around me, and nothing from the unreal world can make me unloving or uncaring. And I care for who I am. I love myself for who I am. I know myself to be true and honest. I know myself to be pure. And I understand that I have died from the old world. Shanti.
Shanti, greetings of peace. Thank you so much, Brother Roger, once again. And thank you, everyone, until we meet again in the next Meditation Cafe series.
Pleasure. Lovely to meet you all.
Thank you.